systemic racial inequities that this county has been subjected to. COVID has underscored the fact that for the last decade and a half, we are still last in terms of healthcare metrics, 62 out of 62. COVID has underscored the fact that in the last decade and a half, we still have the worst unemployment rate in the entire state of New York. COVID has underscored the lack of quality education that many of the kids in our communities suffer through. COVID has underscored the fact that the Bronx has been ignored for such a long time. Now, when COVID hit our communities, myself and my colleagues in government, we went ourselves and took it upon ourselves to make sure that we provide things like PPEs to people in our community. We took it upon ourselves to make sure that we provided food for people who can't even feed themselves. We took it upon ourselves to make sure that we protected the most vulnerable people in our county. We took it upon ourselves to do everything we can to save lives. Now, what are we facing here? When COVID struck us the way it did, 34% of those who died were Latinos. 29% were African Americans. So we're talking about 65% of people that died were in our communities. And that's because, again, the awful healthcare metrics that we have. The governor has gone on national TV indicating that he will not take a vaccine until these very same communities are the first ones that are vaccinated. The mayor has promised to make sure that these poor communities, these poor black and brown communities, after our essential workers, are the next in lines to get vaccinated. Obviously, the mayor is keeping his word. I hope the governor keeps his word, because us in state government, myself, Assemblywoman Chantel Jackson, Councilman Salamanca, we're going to hold their feet to the fire. We're going to push like hell and take no excuses. Our communities suffer too much. Historically, our communities have been ignored. And today, we say no more. If we don't get those vaccines into this community, we're going to raise hell. So thank you, Commissioner. Thank the mayor for following through. Chantel and I are going to make sure that the governor keeps his word. Because if we don't, more people in this community are going to unnecessarily pass away. We see a COVID rate now, about 4,000 new cases yesterday. In this area here, you have anywhere between 12 and 40% infection rate. Luckily, these vaccines are demonstrating an efficacy rate of about 92 to 95%, depends on which vaccine. That's going to save lives here. So I implore you, Commissioner, I implore anyone who has the power to make sure that these communities get those vaccines next. Because if not, we're going to see another crisis here in the Bronx. Thank you.
Thank you so much for those passionate remarks. Next, it's really my pleasure to introduce Assemblymember Chantel Jackson.
Good evening, everyone. I want to thank our Commissioner, our Deputy Mayor, for having this press conference. It's tough for me to walk in a school as I left my job as a school social worker to be an assembly person, to walk in a school and know that kids are not here. But it's good to know that we have replaced it with a place for vaccinations for our community. We have a high density of essential workers in this community and neighboring communities. And so it's extremely important that we have access to vaccinations for people who actually want to get it. The other thing is that this may exist here, but we need to make sure that people know that it's here and how to get access to it. So I'm grateful that you all are here. I'm grateful to be here with you all. But I understand that the communities that absolutely need access to it need to also understand that it's here for them. So I implore everyone to make sure, even though we know this is great that we have the facility, but the people who are hit the hardest need to make sure that they can walk through these doors, get vaccinated when they want to, and be able to live a healthy life. So I thank you for having me here today, and let's not forget our community. Thank you.
And thank you as well for the reminder that this is an important first step, but we have a longer walk ahead of us. And with that, it's my pleasure to introduce Councilmember Rafael Salamanca, please.
Thank you, Commissioner. Good afternoon, everyone. Today is an exciting day as we roll out these vaccines. Someone who lost their father to COVID back in April, it was extremely devastating for me and my family. And it's too bad that we didn't have these vaccines back then where we could have saved a life then. Too many of our family members and our friends have lost their lives because of this pandemic. We're seeing homelessness at a record high, seeing individuals who are at the brink of losing their homes. And we're seeing individuals in terms of our economy where they are losing their jobs and they're having a difficult time where to put a meal on their table. So this is a step forward so that we can revitalize and bring New York back. And I want to say thank you, Commissioner. And it's an important message also to Governor Cuomo. We need to open up this process. We need to see how we can get more people vaccinated. Hearing the stories of health facilities having to get rid of vaccines because they just cannot vaccinate individuals because they don't qualify within that criteria is just dead wrong. And we need to address that. If I can say a few words in Spanish. Buenos días, mi nombre es Rafael Salamanca, yo soy el concejal del sur del Bronx, este es mi distrito. Estoy bien contento de estar aquí hoy, es que estamos haciendo un anuncio que vamos a dar la vacuna aquí del coronavirus para la comunidad aquí en el sur del Bronx. Una persona que perdió su papá en abril porque estas vacunas no estaban disponibles, era algo que es muy doloroso para mí y mi familia. Y como yo, miles y miles y miles de personas sufrieron y perdieron familiares y también perdieron amigos. Estoy bien contento que estamos aquí haciendo este anuncio y le estoy implorando al gobernador que por favor abra el proceso para que podamos vacinar muchas más personas. No entiendo el por qué ciertas clínicas tienen que botar las vacunas porque el gobernador no ha abierto. Él no ha abierto la habilidad para que vacunen a todo el mundo en nuestras comunidades. Y con eso, que Dios lo bendiga. Thank you, Commissioner.
Thank you so much, Councilmember. With that, and I'll ask the press colleagues at the Health Department to guide me here, but we're going to open it up for a brief question and answer session before we do the walkthrough of our vaccine hub. Please.
From Africa in Harlem. There is the assumption that all we need is to get these vaccines available and people will just take it. Some members of the Black community are saying they're not taking the vaccine. And it's not like if the city does a campaign, they can convince them to do so. For reasons that we all know, structural racism. So now, what is the city planning on doing to make sure that these people are vaccinated? That's one. And what are the health implications if some are vaccinated and some others don't want?
Mm-hmm. Allow me to start, and then Deputy Mayor Hartzog will add on as well. First, thank you for asking such an important question about how our vaccination campaign takes into account the equity concerns, and particularly the racial equity concerns that you're raising. What I can start by saying is that equity is a foundational pillar of how we think about turning vaccines into vaccinations. We do know that there are greater rates of vaccine hesitancy in certain communities, particularly communities of color in New York City. And what we have to do as the city, and what we're committed to doing, is communicating the best science-based information ourselves, but importantly also enlisting the institutions and the people who are the most trusted in those communities. We don't have to talk in abstractions. We're here in a place where there are doctors and nurses who have been taking care of people for years, if not decades, in the Bronx. And we want to give them the information and the power that they need to speak to their own patients. We're also going to be partnering with faith leaders, with community-based organizations who have built those trusted relationships over time. And I'll turn it over to Deputy Mayor Hartzog to say more.
I would just add, especially on the piece about community-based organizations, one of the things that we did as part of the Test and Trace Corps is not just look to our doctors and our nurses as part of health and hospitals and Department of Health, but all the community-based organizations, more than 200 strong across the city, to actually help us with messaging the importance of, at that time, getting tested and now getting vaccinated. Those are the credible messengers that communities listen to, and we know full well of that. That relationship is going to continue on through vaccinations. And I will also just point out the leadership here of our elected leadership, having personally gone through the struggles that they have gone through as the council member here. I'm just so sorry for your loss. These are our credible messengers helping us to actually get vaccination in as many arms as possible, and also explaining the importance of getting vaccinated, to the commissioner's point, what the risks are, what the reality is, and the most important part that I think many of us want, and I heard our elected leadership here in the state say, is to open up our economy again, get jobs back, get people up and running back in our city.
Thank you so much. And I should say, if you have a question directed at someone specifically, please let us know.
Do you have any numbers on how many people could get vaccinated this week? Governor Cuomo yesterday was saying at the rate he sees it would be 47 weeks before everyone who wants a vaccine can get it.
Yes, this is an important question about how quickly we're able to turn vaccines into vaccinations. It's dependent on a few different things, making sure that New York City and New York State, have the supply of vaccine from the federal government, addressing some of the issues that were raised about ensuring that people come to get vaccinated. But then why we're here today is to make it as clear as possible that the city will be standing up as much administration capacity. Places like these vaccine hubs, places like the sites that the mayor has announced, the mass vaccination sites, and all of those other providers, in communities, whether it's a community-based clinic or an urgent care center, to actually get shots into arms. So in terms of the time frame, we want to go as quickly as possible is our operating principle with the supply that we have from the federal government. We do know that it will take several weeks, likely several months before we have enough supply to be able to vaccinate the general public. But our goal is to move rapidly as eligibility expands to go from who's eligible today to the general public.
But like in this facility, how many can you do?
Yes, yes, thank you for clarifying. We can do between about 5,000 and 7,000 vaccinations a day in a facility like this one. That's the capacity that we have.
So is the vaccine physically here? And if you don't have enough people who come, what are you going to do with it so it doesn't go bad? Like, do you give it to somebody who's not eligible, or what do you do?
The vaccine is physically here in New York City. As of tomorrow, it will be physically here in sites like this one to actually be able to administer the vaccine. And there are protocols in place such that if not all of the vaccine is used at a site like this one tomorrow, it remains in the cold storage that it needs to be able to be used for another purpose.
No, I think part of the problem, just to respond on it, is that
Please.
this shouldn't have been a surprise to us, the fact that ultimately we would get vaccines. And yet at the state level, I'm not going to talk about the federal level, but at the state level, I don't think we did enough to prepare us for this program. Like here we are today, we're going to start tomorrow. We just got the information recently. So we have to work overtime, all of us as elected leaders, to make sure that the community here, people that know us, know that this program is available. And so hopefully after today, after the first day, you're going to see a rise in numbers. But the reality is that at the state level, at the federal level, I don't know what happened. Why weren't we preparing for that beforehand? And it's because of that that we have this crisis now.
Commissioner, can I just ask something about the 1B group? How are you going to prioritize them when they start becoming eligible? I believe it's Monday morning. Because right now, it's my understanding there's still a very limited number of vaccines.
Yes, let me make one clarification to a prior question, and then I'll turn to Deputy Mayor Hartzog for your question. I stated 5,000 to 7,000 vaccinations per day. That's across the 3 vaccine hubs that we're setting up beginning tomorrow. So you have to divide that number by 3, so about 2,000 vaccinations per day in a site like this one. Deputy Mayor Hartzog, for Phase 1B.
We are extremely excited that the governor announced that Phase 1B will be opening up. And of course, we have been planning all along to be ready to move as quickly as Monday to open it up. At this point, seniors, 75 and older, first responders, essential workers are the top priority moving forward into this week. And over the coming days, you'll hear more, most certainly from the mayor about that.
But will that be first come, first served for them? How will you prioritize them?
The priorities are the 75 plus, as I said, and then the essential workers. And if you're asking about how it relates to appointments, as I said, you'll hear more from us in the coming days.
But you must have an appointment, though, is that correct?
Correct. That's correct.
So no walking.
No.
What was the kind of logistical and psychological importance of opening up to 1B and not just staying at 1A? And for maybe the elected officials here, why do you think the governor sounded almost reluctant to open up 1B at his press conference yesterday?
Well, I'll leave it to the electeds to answer the question you just directed.
As I indicated before, I don't think we were prepared for it. And I think that's part of the reluctance. Look, I know that sometimes the dispute between the mayor and the governor creates problems for people who need help. And I'm not questioning the motive of the governor or the mayor, but the reality is that has happened. The mayor has made an effort, I believe, to expand the number of people that get the vaccination, but there seems to be a problem in Albany. And so we have to stop the fighting in the sandbox and look at what's the priority, saving the lives of our people. So if we're not prepared for it, shame on us, because we know that this is ultimately going to happen, but we weren't prepared. And so I applaud the effort of the mayor, and you know, I've sent the message to the governor, we got to move faster. Because if I sound super passionate about it, it's because I've seen so many people in our community die. People that were chair of community boards, people that were precinct council leaders, people that were just friends of mine that died unnecessarily. We should have been better prepared from the onset.
Do you think having that 1B option will help get the remainder of 1A on board, potentially, given that there's still a lot of 1A that hasn't gotten the vaccine yet?
I mean, of course, the commission can answer this, but I think the more that we open up as much capacity as possible to as many people who are as eligible, the more that people obviously will want to do it. Just to the point of what we've done in the city, the mayor's given us a clear charge that we have got to move as quickly as possible, and we have to stand up as much capacity as possible, given the limited supply, but that we have the ability to get to communities hardest hit, like the one that we're in today, to provide the vaccine. Again, should supply be available, and we have the go-ahead for the eligibility. But that is our charge, and I think we have done an amazing job. I thank you for that. Applause for us in getting our capacity up and running. So I will turn it over to you, Dave.
I have a question.
I'll just, if you don't mind, I'll just finish on this question, and then please ask your question as well. I just wanted to say I really agree with what the deputy mayor has said with respect to making sure that we have expanded capacity so that we can be nimble as eligibility expands, as we have seen. We know from experience in large vaccination campaigns, both in our country but also globally, that this is how to get shots into arms as quickly as possible. We have to make sure that eligibility does expand in a swift way so that when we see that some people may not be coming forward for vaccination, we can move to other prioritized categories and have them come to get vaccinated as well. So I do think it's a major step forward. I want to make one specific comment again as a doctor. The thing that I've been so worried about, over the course of the pandemic, but particularly over the last few days and weeks, is seeing that older New Yorkers who are at greatest risk of the most severe outcomes from COVID-19, we have to take steps to protect them. That's why I issued a commissioner's advisory in early December as we saw the numbers go up for the steps that we could take as communities to try to protect them. And what we saw with respect to older New Yorkers being prioritized as part of Phase 1B starting on Monday, this will give them another important layer of protection through vaccination. So this is critically important for our ability to be able to save as many lives as possible.
And how will you make sure that those who've been vaccinated, have received the first dose, get the second dose? What's the system in place for that?
Right. I can speak about it generally, and then I'll speak about it in the context of what happens at a vaccine hub. The starting point is that the vaccines were studied in the clinical studies that were done in a 2-dose regimen. That's how they achieve those levels of effectiveness of greater than 94% that you have heard about. For the Pfizer vaccine, the second dose occurs 3 weeks after the first dose. For the Moderna vaccine, it's 4 weeks after the first dose. We have been planning and preparing to make sure that people get their second dose in a way that is as streamlined as possible. The way that it will happen for most people, whether at a site like this or at any other site, is at the time that they're here, that they're sitting in this chair, waiting to make sure that they're okay after their first dose, there will be a system set up so that they're actually able to make an appointment for their second dose during the same workflow. And that way, we take care of scheduling that appointment at the same time that they're here for their first dose. There are other ways that we're ensuring that this happens in our city system that tracks all vaccinations. We're able to send out reminders if, for whatever reason, the person was unable to schedule their appointment, or just to ensure that they know about the fact that they're due for the second dose of the vaccination. And then finally, that vaccine card that I mentioned will have the date of their first dose and will indicate when they need to get their second dose as well. Yes?
I know we're in a high school right now that's closed for only open to remote learning. The one in Queens is in a high school, and other facilities are places, schools that are currently closed. How long do you anticipate this being open and used as a vaccination center? I know the mayor had previously said it would not interfere with schools reopening, but looking at this now, this would mean if, let's say, this remains open, and it could take months to move beyond 1B. It just doesn't seem that it would be at all feasible to open schools while allowing these to be used as vaccination centers. So what's the plan there?
Yes. Well, first I'll say, our goal is to reopen schools. As we know, and as I spoke about, the fact that schools are so important for the health of our children, but also for the health of our communities. So the mayor has made it his charge that we should try to get schools open, as soon as we can, given the safety record that we've seen within schools as well. We anticipate that vaccine hubs like these will be open for weeks. Part of the reason that we did cite them in high schools and middle schools is because they are closed, as you're pointing out. As we approach being able to reopen additional schools, there are ways that we can factor in to ensure that it doesn't interfere with instruction during the school day, starting with the fact that we can continue these on weekends, rather than having them on weekdays. So we have a few different mechanisms that we're able to use operationally to ensure that we both have a very large vaccination capacity at the same time that schools can operate. Yes.
You touched on it a little bit just in terms of neighborhoods that were hardest hit, but looking all around the city, the fact that you're only opening up a couple of these so far, why was this location specifically where you wanted to have this hub?
Sure. Thank you for this important question. Well, we're here, and I invite the elected leaders to comment on this as well. We're here because we know how much this community has been affected by COVID-19, and that's what characterized the locations for the first 3 sites that are opening tomorrow, as well as the additional 12, so a total of 15 sites that will be open as of next weekend. All of them are characterized by the fact that it's the confluence of the immediate impact that COVID-19 has had in specific communities, overlaid with some of the historical factors that you've heard my colleagues talk about that have led to those severe outcomes from COVID-19. So part of selecting the locations for these sites is really to meet that equity imperative that the mayor has laid out for us. I invite if anyone else wants to make comments.
Yeah, I think that this site is one that is necessary because of its closeness to a train. In the Bronx, a lot of our places are two-fare zones, really hard to get to. And what I'm thinking about is our seniors, the people who absolutely, you know, my seniors are the ones who actually want to get vaccinated of all the people that I talk to on a regular basis about this. And so our seniors need to have access to somewhere, be able to get to somewhere easily without too many different modes of transportation to get here. And so access to a train is absolutely necessary in the Bronx, and this site provides that. So for me, my concern is our older adults who actually want to be vaccinated, that they have access here. And I would ask that the mayor also consider that we need to think about how we're going to get this messaging out to them, because they're not on social media like myself. They may not even have an email address to get this information. So the question is, how and which are we getting this information to them, right? And so I would ask for us to consider a door-to-door in places like where I live, Concourse Village, where there's a lot of older adults. When we know there are spots of older adults, we need to make sure that we're getting to them, letting them know that this site is here for them.
You can see the infection rates around this area. The surrounding areas, the infection rates are hovering around 12.6% and almost as far as 14%. So it just makes sense. These areas, underserved areas, health metrics poor, this is the area where we have to concentrate a lot of the effort, because this is the area where a lot of people are going to die if we do not.
Yeah, I just want to make one last point. And this is a good first step, Commissioner, opening up this site at this location, but we also need to be realistic that in the South Bronx, Hunts Point numbers have gone up tremendously, which is about at 16%. It's gone up so badly that I have opened up my office to do on-site testing for COVID-19. And I implore you, Commissioner, to look at other sites in the Bronx that have been affected dramatically, especially those that are suffering from major health disparities such as asthma and diabetes, and that's deeper in the South Bronx. We're in the South Bronx, but we got to go deeper. Thank you.
If I could just follow up on something the Assemblymember mentioned, what is the strategy for the city to reach out to those over 75 who may not have any kind of experience on the internet?
Well, first I will say that's going to be what you're going to be hearing from us in the coming days. But obviously, one of the things that we know that we can leverage is our infrastructure of hundreds of senior centers, home-delivered meal programs. These are run by community-based organizations who know our seniors, NORCs, nationally retiring communities that are run of various housing programs. So we know where our seniors are. We know with community-based organizations, they know how to get to them. And so we are definitely going to be hearing more from us on how we're going to leverage that entire infrastructure to get the message out. And as we said, get as many vaccines in the arms of our seniors who are the most vulnerable.
We have time for one final question before we go on our walkthrough.
I just want to clarify one thing. If school is in session, this vaccination center will not be operational during those hours. Is that correct? Did I hear you right on that?
It depends a bit on the specific site. There are some sites where in our plans we're able to have flow through the site that would not interfere with instruction during the school day. So these are things that have been planned based on the physical layout of specific sites.
Has that been worked out with the teachers union, because the guidelines for what's going on in the schools have been so strict?
We've been working with our colleagues in the Department of Education, as well as with city security staff with respect to managing that flow. Thank you for your question. Okay. With that, I just want to thank particularly my elected colleagues for joining us today. Thank you again to Deputy Mayor Hartzog for your leadership of the entire vaccination campaign, and to our health department staff for their literally around-the-clock work to be able to stand this up. Patrick Gallahue, the press secretary for the health department, will lead us through next steps. I just wanted to mention that the elected officials, as well as Deputy Mayor Hartzog and myself, will be available for additional